Every time I tell somebody that I don't have health insurance, I get this reaction. What do you do? What are you going to do? I go to the doctor if I need to, and I pay out of pocket. It would cost me $1,200 a month out of my paycheck to put my family of 5 on a health insurance plan through my job. And as somebody who's not very sickly and doesn't have a very sickly family, I really just can't imagine giving $1,200 a month to an insurance company who's going to turn around and tell me what they are and are not going to pay for, and then they're still going to make me pay a copay when I go to the doctor's office. And by the way, the copays that y'all pay is pretty much what I pay cash out of pocket when I go. So I have this grand idea that if we all did not sign up for insurance and instead take that money that you would spend to your insurance company every month and put it into a savings account that is strictly just for your medical things, then you get to decide what you pay for medically, and you don't have somebody else telling you who has your money that you paid saying, oh, we're not going to pay for that. We don't think it's necessary. I know that may not be ideal for everybody and everybody's situation, and there are situations where insurance is a good thing and it really does help, especially state-funded insurances for people that are in, tragic situations or need like a lot of long-term care, or families with special needs, children, and I get that. So I know it's not for everybody, but also everybody doesn't necessarily need insurance. In my opinion, I'm fine. And if something bad happens and I get into a car wreck, they're not going to take me up in there and be like, well, I see you got 2 broken legs and you're bleeding from your right lung, but we got to send this one home because she don't have health insurance. Guess what? They're still going to treat me. And then I'm just going to pay, the minimum monthly payment on my bill if I need to do that until I get it paid off. Or, maybe I'll save up what I would pay to my insurance company and I'll pay it towards that hospital bill. I mean, that's what makes the most sense to me. If you really think about it, why would I pay an insurance company $1,200 a month? And then I'm still going to have to go to the hospital and they're going to overcharge my insurance company. But then I'm going to also have to come out of pocket, I don't know, maybe another $1,200 to the hospital. And it's a scam, guys. It just doesn't make any sense to me. And that's how I choose to live my life. Don't judge me for that.